Shania, you screened a lot of people for this study, well over 500, and more than 400 were excluded because of low use of opioids. Would you like to comment on this?
So, as the screener, I can absolutely empathize with the challenge of needing to screen so many patients, but that is the reality of clinical trials for you. Um, so, out of the total 575 patients who were screened, you're correct in that 442 of those weren't eligible for the trial because of low use of opioids. And this is consistent with what we know about population-wide use of opioids before surgery. We know that approximately a quarter of patients in the population don't use opioids on a regular basis. And in fact, this is encouraging to see. However, given the large volume of these surgeries, I still do believe the value of pre-operative opioid tapering for those who are on opioids for a regular basis is still there.
So, Jonathan, what next? This was a pilot study. So, is there a larger study planned, or indeed is there one underway?
Yes, we were very lucky to get government funding for $1.5 million to run a definitive trial because I was so impressed by this pilot data. So we're currently running that. We've only started recruitment a couple of months ago, and that will continue until next year. What's great about it is all of the pilot studies were so impressed by the pilot that they've all stayed on for this definitive trial. Other sites have also expressed interest because they've been so excited about it, and that's really great to see for those who work in practice. We know how hard it is to change practice, and if all the clinicians are jumping up and down that something should change, you know there's a lot of benefit here. So we're really excited. The larger trial is happening. We're going to have more pharmacists, a lot more patients, and that will be primarily powered to look at those pain and quality of life outcomes that you've talked about earlier, and to see if we can reduce that persistent opioid use 3 months after surgery.
What are the implications of your findings? Could or should this sort of scheme be implemented more widely? And indeed, is it continuing in the pilot sites?
What I like about this intervention is, as a pharmacist, we often do improve the medicines, the regimen, but we don't know how much that improves their life. The fact that we're getting such promising results, not just after the intervention, but even 3 months after the intervention, to get such sustainable improvements, it just shows you the value that pharmacy can provide to their patients. That when we improve their medicines, we could be improving it for much, much longer than you realize, and having much, much stronger impact than we realize. A couple of things that I really enjoyed from this is we did audio record all of those opioid tapering interventions and listening to what the patients said about it and how they found it. And so many of them were just so grateful to have someone listen to them, to validate what they've been going through with their pain, and to support them through the opioids. In fact, most of them said, I've never had any benefit from these, but I just don't know how to get off them, and I really would love some help. So I think we've got patients who are crying to have pharmacists to be more involved in their care, to be more present, to listen to them, to validate what they're going through. And that's something that a lot of pharmacists can do. And it was just so exciting and wonderful to hear all of those positive remarks.
Mm. And my last question. You've mentioned other disciplines briefly and emphasized their input. I wonder if you could just round off with a few comments about your team and put the pharmacist's input into perspective.
Any work of this caliber is extremely difficult to do with one person, and we have a very large team. And one of the unique aspects is how multidisciplinary it was. We have pharmacists, we have nurses, we have GPs, we have anaesthetists, we have physiotherapists, we have orthopedic surgeons. And we know how rare it is to get all of these people together in one spot. And for all of them to say, this is a really good intervention, we should be doing this, pharmacists should be leading it. It's just beautiful to hear. You don't always hear that pharmacist is the most obvious choice, but in this case, they are. They're happy, they're competent, they're capable, and everyone else doesn't want to do this because it is not their area of expertise. Well, with pharmacy, we're very comfortable because we know this. We know opioids, we see tapering, we know how to taper, we know what to expect.
Dr. Shania Liu, Dr. Jonathan Penm, thank you very much for sharing the details of this very important project with us today. It really has been fascinating and inspiring. We look forward to hearing more about it in due course. For more information about the work of Dr. Liu and Dr. Penm, please visit our website using the link in the description. And please subscribe for more news, videos, journals, and podcasts. For updates straight to your inbox, please follow the links below. And thanks for watching.